of spreading breast cancer awareness. And here we are to talk more about early detection, symptoms, treatments, everything. You can also send us your questions and we will be taking them live, and Dr. Raskah will help us answer them. So this is a very heavy topic, but it is a very, very important topic as well. We keep reading the news every day, and one person is diagnosed with breast cancer every 19 seconds, they say, and that is actually huge, and we're here to control it and try and detect this and try to eradicate it as much as we can. So right, Dr. Raskah, can we get started?
Yes, of course. Let's start.
Okay, so first and foremost, tell me, Dr. Raskah, what is breast cancer and why is it important to address this issue, and why should we be talking about breast cancer?
So in 2022, the statistics were staggering. There were about 2.3 million women who were diagnosed with breast cancer, out of which 670,000 people lost their lives. And early detection of breast cancer has a survival rate of 99%. So if you see that 670,000 people who died and 99% survival, if it was just detected earlier, I think we have a real need to talk about the topic and get ourselves detected as early as possible. So that's why this is so important.
Absolutely. And like I was saying, we really need to create a space wherein we talk more and more about a condition, a disease which is deadly, and more people need to know about it so that a lot of examinations can be started much earlier and at home by people even before they go to the doctor, and they realize the importance of visiting a doctor and detecting this problem early. So tell us, doctor, what are these early signs of breast cancer and how should one detect them, and how should one then reach out to the doctor?
So I would say if there is any change in your breast, any change at all from your monthly self-examinations, go visit your doctor. Not all changes are cancerous, but some could be. So it's better that any change that you feel, whether it is a pain or a lump or just the contour is different, feels lumpy, any change would be a sign for you to meet the doctor. So what are the signs that we would look for? First of all, a lump, any swelling, any redness, any rash, the skin looks like the appearance of an orange peel, any discharge from the breast, especially if it is a reddish color discharge. These would be the signs that we would be looking for. Any lumps in the axilla or the armpits would also be a sign towards breast cancer.
Are there any lesser common symptoms or things that help us to understand that there could be a breast cancer issue?
So like I said, the most important thing is whether there is a change in the breast as compared to what it was the previous month. Any change could be breast cancer. So whether it is just a lump or just a feeling of heaviness or just a skin change or it's looking a little redder than before, any simple change that you feel as compared to the other breast or the previous breast examination would be a chance for you to go and meet the doctor.
Right. Tell us, Dr. Raskah, are there any genetic factors that play a major role in breast cancer? Like, they usually, a doctor will ask you your family history when it comes to any kind of cancer and also breast cancer.
Yes, so every type of cancer has an hereditary component. About 10% of breast cancers are inherited. So these are related to the BRCA1 and BRCA2. These are the most widely studied genes. These can be inherited from both parents, but if your maternal history, so your mother, your aunt, your sister has breast cancer, then you have a higher chance of developing breast cancer. Certain ethnicities like Ashkenazi Jews, they are more prone to developing breast cancer because these genes run in the family. Apart from these BRCA1 and 2, there are other genes like the TP53, the PLAB2, the ATM. There are a lot of genes associated with breast cancer, but the most important thing is to know exactly what your family history is. So a doctor can take your previous family history and then determine at what type of risk you are at. So sometimes screening procedures would be started about 5 to 10 years earlier than your nearest family member who has developed cancer. So this family history becomes very important for us.
But are you saying that in case the family, there has been any kind of cancer, that kind of increases the risk of breast cancer as well? Or is it just if there has been a case of breast cancer in the family?
So breast and ovarian cancer increases the risk a lot, but there are something called as family cancer syndromes. So a person from the family having leukemia, pancreatic cancer, colonic cancer, some of these type of cancers are associated with also having breast cancer. So it's not just looking forward to looking to knowing exactly if it's only breast or ovarian cancer. Any other type of cancer in the family, if it falls within the family cancer groups, will carry an increased risk of developing breast cancer.
So in that case, let's come to understanding what is that age that people should start getting screened for breast cancer in the case whether there has been a family history or otherwise.
So if you don't have a family history, then nobody in your family or your immediate vicinity has been having breast cancer, we would say age of 40. So I advise my patients to give it to themselves as a birthday gift. 40 years of age, screen yourself for breast cancer. That mammogram is invaluable. If you have a normal mammogram at that age, then at any changes that occur thereafter, we can compare it to your previous mammogram, and it's invaluable advice, invaluable documentation that we have. If you have a family member who has cancer, then we would see either 5 years before or 10 years before that person has breast cancer. So, for example, you would be screening yourself at 35 years of age, or say if your mother has breast cancer at 52, then you would have to consider definitely getting yourself screened at least by 42. So it's 10 years before the person has breast cancer, the family member has breast cancer, or 5 years before the age of 40. So by 35 years.
Right, understood. Tell me, this is interesting. A lot of men don't know this, but men can also get breast cancer, right?
Yes. So it is not as common for men to get breast cancer as it is for females, but 1 in every 1,000 breast cancer cases is actually a man detected of breast cancer. So why does this happen is because even though males don't have functional mammary glands, they do have rudimentary mammary glands. These mammary glands have the similar cell structure as a female breast. So when the hormones act on it, the DNA, the genetics have been passed down, they still act on these elements, and therefore they get breast cancer. But because it is so rare for men knowing that they have breast cancer, they will think it's maybe, if it's a small rash appearing or a change in the skin, they would first think it's maybe a fungal infection or something, and then end up coming much later to the doctor for diagnosis of breast cancer, and therefore it has spread much further. So it is important for men to know that it is a possibility that it could be breast cancer.
Right. So tell me, doctor, are there any real reasons for why this may happen? Why would someone get breast cancer? Apart from, of course, it being in the genes or the family history, what else?
So we have these things called non-modifiable factors, which is obviously the genes, the age. As you age, you're more prone to developing breast cancer. And we have something called modifiable factors. These modifiable factors are your lifestyle. If you're obese, you have a central fat. This belly fat acts as an extra endocrine organ. By acting as an extra endocrine organ, it means that it is metabolizing these hormones, and the onslaught of hormones onto the breast would be much more. So if you're obese, you're having extremely processed foods. These processed foods, unhealthy foods, they end up breaking the DNA much more, which the DNA may not, or the DNA repair mechanisms may not always be able to fend off all these breakage of DNA, and this can cause cancer. So lack of activity, having too much processed foods, a very high BMI, saturated fats, trans fatty acids, consuming bakery products on a larger scale as compared to green leafy vegetables, meat, because to cope up with the increased demand for meat, they will inject these animals with hormones to fatten them up and mature them, and then we are consuming these hormones by ourselves. So it increases the onslaught of hormones onto the breast. So these are all factors that would increase. So clean eating, decreasing the body weight to keep it within the normal BMI, a lot of activity to increase the antioxidants. These would all be protective mechanisms that we could. In addition to that, breastfeeding. Breastfeeding your baby for a longer period of time is protective. So the longer you breastfeed your baby, that would be more protection for the breast. So that is another factor we could put in for protecting ourselves against breast cancer. Yes.
Okay. I also want to address another issue with you, and tell me if this is related as well. We take a lot of stress in our day-to-day lives. So tell me, is stress a factor that impacts breast cancer?
So, with stress comes in a lot of other factors. So, increased stress would decrease sleep. Decreased sleep would result in increased levels of cortisol, would result in decreased antioxidants in our body, decreased ability of the body to fight back. So, what we say is generally during the sleep, there are a lot of mechanisms in place where the body helps clean up the system. And if you don't get the appropriate sleep and you don't be mindful and you don't calm down, these factors, these oxygen radicals, they are freely moving in the body, damaging the DNA as and when they want. So if you can manage to decrease your stress, improve the quality of your sleep, you will be helping your body clean up. There is a lot of DNA protective mechanism, DNA repair mechanism that our body has, which we kind of lose when we are just constantly on the move, stressful, multitasking, not really concentrating on doing what we're supposed to be doing for our health.
Understood. So tell me, Dr. Raskah, let's now move on to understanding what are the treatment options available. I believe it depends also on what stage the cancer is at and how early it is detected. So please take us through.
So, in general, we have the surgical line of treatment. We have chemotherapy and radiotherapy. What type of therapy and particular breast cancer patient will undergo depends upon which stage of life she's at what stage of cancer she has come in, how big is the cancer in proportion to her breast size, what is the cancer susceptibility of the patient. Are we doing it prophylactically or are we doing it for diagnosis? So, in the surgical method, there are two types. We have breast conservation cell surgery and we have the full removal of the breast. So, a lot of people have not found any statistical difference between breast conservation and removal of the entire breast. But, for example, if you've been diagnosed with breast cancer, say, during the first trimester of pregnancy, which is a thing, breast cancer can occur even in pregnant women, we would not be considering radiotherapy for the woman during pregnancy because that would be harmful to the fetus. In that case, we would consider removing the entire breast, even if the breast lump is very small as compared to the size of the breast. So we have like a lot of drugs now, a lot of different type of therapies which can be tailored to each person so that we can give them the best chance of survival.
Understood. Well, at this point, I just want to tell all our audience that we are trying to address as many general questions about breast cancer, but you are free to send in your questions and we'll have them answered by Dr. Raskah. Thank you so much for sharing such detailed knowledge and awareness about this condition. We'll move on. I wanted to also really ask you this question. They say that breast cancer is more common in the left breast than the right. Is it true?
They have found there was this myth going around that left-sided cancer was more than the right, and then they wanted to find out exactly if it is true. There wasn't a statistical difference, but they did find that breast cancer was 50.2% times more on the left breast and 48.8 times, 49.8 on the right side. So there was just about a 4.04% difference between the two. So not really significant, but it does. And there have been a lot of theories as to why there would be this slight difference. One is because both breasts are never symmetrical. So if you look at yourself in the mirror, you would always find the left breast to be slightly bigger than the right. And maybe that is because there would be a slightly more breast tissue in the left breast as compared to the right. So that could be one of the factors. The second is most people are right-handed, so they would be examining themselves much better and they would find it easier to find any lumps on the left breast. So maybe that's why they come in earlier and we diagnose them faster. And the other thing is sometimes when women are breastfeeding, they will tend to favor their dominant hand. So they will hold the baby on the right side, which means that the right breast inevitably gets drained much more, or gets emptied much more as compared to the left. So when you empty the breast completely of milk very regularly, you're protecting the breast against breast cancer. So there have been these different theories that have been put forth that maybe that 0.4% difference could be because of these, but it's not really statistically significant. So you could get breast cancer in either of the breasts. It's not like if you don't have it in the left, then you're set for life. But there is a slight increase in the left side, yes.
Yeah. And tell me, doctor, once somebody has had it and they have kind of treated it through surgery or chemotherapy, what are the chances of it relapsing, and does it ever relapse?
There is a chance. One, because it's the same type of tissue, right? Breasts are being onslaughted by the same hormones, the same genes on both sides. So there is a chance, biologically speaking, that if you have had a breakdown of the DNA repair on one side, it could definitely happen on the other side. There are certain types of breast cancer, like lobular breast carcinoma, which is very commonly found bilaterally. So sometimes you may find it on one side and you may not have found the lesion because it may be too small to be detected still on the other side. And then if you follow up these patients for a couple of years, you will find them developing it on the other side as well. So it's not that all breast cancers will definitely come on the other side, but certain types of breast cancers have been known to be bilateral that will eventually occur on the other side as well.
Right. So tell us, doctor, when someone wants to do a self-examination at home, as you said, there are certain things that you look out for in terms of the breast changes and the discharge. How do you perform a self-examination to understand these changes?
Okay, so first of all, you need to derobe yourself up to your waist. So you need to be able to look at both your breasts, look to see if there's any rash, if there's any dimpling, if there is any change in the skin. If any one part of the breast feels fuller than the other, look at the level of the nipple, if it's exactly the same, or one is being pulled in, pushed out, a little higher or lower. Any significant changes, like I said, the left side of the breast is generally a bit bigger than the right, which if it's continuously like that, that's fine, it's completely normal. But if you suddenly found a new change, suddenly one breast is looking much bigger than the other or disproportionately bigger than the other, then you need to get it checked. After that, you will need to raise your hands up above your head. Okay? That way the breasts get lifted. Now you can see the bottom part of the breast. So you again look for any skin changes, any rash, any change in the contour, any lumps or anything on that side. The next is you put both your hands on your waist and press it together. By doing that, you're contracting the chest muscles, which pushes for any small lumps that would previously not be seen. You do this with sitting position and then you do the same thing lying down. Once you do the looking part of it, you have to do the palpation part of it. So assuming this is the breast, okay? What you need to do is use the pad of 3 fingers, not poke, but the pad of 3 fingers and palpate in small circular motion. Either you go around the breast or you go in straight lines. The aim is to cover the entire breast. So don't like start on top and then go down. It has to follow a certain path. Whichever path feels comfortable and natural to you is fine. But the aim is to cover the entire breast. Start at one point and involve the entire breast. That is what is important. And when you're holding the breast, if you palpate like this, okay, just pressing the breast together, you're always going to find it lumpy. So you don't hold like this. You just support the breast with one hand, and with the pads of the 3 fingers, you will do gentle movement. It is this pressure, and you're checking if there is any lumps this way, not by pressing. There's always going to be lumpy if you press like this. So that is how you do the self-breast examination.
And you have to do it very gently, I believe. You don't do it like with...
First is you do a general palpation. If you find there's any area of concern, then you will do a deeper palpation. But the most important thing about the self-examination is at what part of the cycle you are at. So if you're a menstruating lady, you have to do the breast examination between day 7 and day 10 of your cycle. So say the first day is considered to be the first day you start bleeding is day 1. So count from then and mark it on your calendar. Day 7 or to day 10. Any of these days, you can choose one day. And every cycle, you will repeat it on the same day. So it's not the same day. It's not like if you examined yourself on the 1st of the month, you're going to now examine the next month on the 1st of the month, irrespective of the timing of your cycle. It is based on the cycle. Because certain parts of your cycle will cause certain changes in the breast. So to know whether the breast is being examined, you have to examine at the same time every month, because that will be the texture, that will be the consistent. If you examine yourself in the first part of the cycle 1 month, and then in the second part of the cycle the next month, your breast will feel completely different. So you will not understand whether there's any new changes or not. So Post-menopausal women, they can choose a date. So if they are going to examine themselves, say, on the 5th of the month, then 5th of the month is fine, because since they have no cyclical changes, it's going to be the same date. Whereas in case of menstruating women, it is the same day of the cycle. That is the difference.
Understood.
And that is extremely important.
Yeah. So the days could change, as you said, for menstruating women. In fact, I think a lot of women also face some kind of sensitivity and pain as they are approaching the cycle. So if they are trying to examine at the time, they would feel some pain and discomfort even while doing self-examination. Right. Okay. So we've got a lot of interesting questions coming in from our audience. I'm going to start with the first one that I've just received. Tell me, is breast pain always a sign of breast cancer, or could it be anything else?
In fact, if there's pain associated with the breast cancer, it is either one, a very late stage of breast cancer, or it is not breast cancer at all. So pain is generally a symptom. It could be an inflammation. It could be a mastitis, that is just inflammation of the breast. It could be an abscess or an infection of the breast. It could be just cyclical mastalgia. That is a certain time of the cycle, either mid-cycle or just before the periods. There may be a flare-up of pain in some women because of the effect of the hormones. But generally, cancer does not present with pain. It's only in the late stages when it breaks through the skin, it is making an ulcer, it is a fungating mass, with them it starts causing pain. But it is not one of the early symptoms of breast cancer.
Right. Got it.
Don't wait to detect breast cancer. If you find any lump, come in earlier.
Right. Got it. Okay. Abhimanyu asks, does alcohol and smoking have an impact, and does it increase the risk of getting breast cancer?
Yes. All these hormones get metabolized in the liver. So if you're taking high amounts of alcohol, you're damaging the liver, which means that the hormones will remain in the blood for a longer time. Therefore, the onslaught of these hormones on the breast is much higher. So alcohol does have a definite link to breast cancer. Smoking has not been shown to have a direct link. However, because there are so many carcinogens that we smoke in when we are taking smoke, that they would definitely be causing some kind of DNA damage. And especially if you're already at an increased risk, then it would be causing your second step of DNA damage, and it would increase the risk.
Right.
Alcohol, there's a definite link in the studies. Smoking is more common sense type of link.
Right. Got it. Ashima asks, does diet help to prevent breast cancer, and what is the kind of diet we should be following for it?
So plant-based foods rich in antioxidants are protective against all forms of cancer, especially high-fiber foods, protective against all types of breast cancer. Clean eating, having homemade foods as opposed to having processed foods are always going to be protective against all forms of cancer, particularly also breast cancer. So the quick lifestyle, buying something from outside always, every meal in deep-fried, trans-fatty foods have been shown to have a very high incidence of breast cancer as compared to someone who's having a clean eating. So the food, lifestyle, exercise have direct links to breast cancer. These are avoidable or modifiable factors for breast cancer.
On this, I just want to ask you one thing, Doctor. As you were also mentioning before, that sometimes the meat that we buy from out, even though it's a homemade meat or chicken or something that we are having at home, but it may still be filled with hormones because they're being injected into it. So it's becoming increasingly difficult to identify, even though we are not straight away going for fast food or something that's processed. How do we identify clean?
So if you know where the things on your plate are coming from, so like farm to plate type of, if you can figure out exactly where your food is coming from, eating organic foods. But we say this, but it's very expensive. So not everyone has the access to the cleanest products. But keeping your food more plant-based, for people who are used to having meats every day, maybe taking at least 1 or 2 days a week to be vegan or veg-based, would definitely make an impact on the chances of them developing breast cancer or any type of cancer for that matter.
Right. Doctor, I have a question from Poonam who asks, how frequently should we do self-examination?
Every month. Every month on the day of whichever day you have chosen, if you're a menstruating woman, between day 7 to day 10, And for menopausal women, on the date that they have decided, every month you should examine yourself. Once you do it, it becomes a habit. It's just like part of your routine. People go and do their hair once a month. People go and get a manicure, pedicure, things done regularly. Same way, examine the breast. It's once a month, best practice. Screening is once in 2 years, but self-examination once a month.
Yeah, that's what I was coming to. So self-examination you can do, but any screening. So now when it comes to screening, I know that there are mammograms, and I would like you to take us through what a mammogram is. And some people say it is painful. So tell us, when is a mammogram important? And I know that there are ultrasounds as well that you can do. So when should we do which one?
So it actually depends upon the age you're at. So as a younger woman, the breast tissue will be more denser. So if you try to do a mammogram at a very younger age, like say 28, 30, 32, the breast tissue is very dense. So you can't read the mammogram as well as when a mammogram is done maybe at 40, 45. That breast would have less dense tissue and more fat. So the lines of demarcation are more clearer. So that's why generally when you come to the doctor, we will assess to see the density of the tissue, what it feels like, and then accordingly we will advise whether some person would get a better benefit of doing an ultrasound or someone would be a better benefit of doing the mammogram. So mammograms are painful because it involves the breast being crushed between two plates. Even though there is a padding placed, it is because the breast tissue gets compressed. But this soreness lasts for about 24 hours, and after that it should have settled. Also, you can do like a hot compress or a cold compress, whichever one feels better for you, just for that time. It is not a very severe pain, uncontrollable pain or something like that. It's just a discomfort, and especially the smaller breast size, because there is not much of the fat tissue to cushion that compression, which tends to have a bit more pain as compared to the larger breast size.
Got it. I have a question from Hania, who's asking, can there be no symptoms and still the person has breast cancer, and how to know that?
Yes, there can be no symptoms because cancer does not always present with pain, or it may be a little deep-seated in breast cancer. Self-examination, that would be my keyword. Examining yourself every month. So if you examine yourself every month, you get used to what your breast feels like. So even as you age, every month the cyclical changes are changing the breast. You get a general feel of what your breast is like. And the smallest changes you feel, if you present earlier on, you can maybe once you come in for your screening every 2 years. But the main thing is the self-breast examination. The minute you start doing self-breast examination, you're protecting yourself. Any simple change. Most of the times when women come to the OPD, it's not really breast cancer. It can be a fibroadenoma, fibrocystic disease, anything. But once you get that feel of, okay, this is what my normal is, this is something a little bit off, I need to go and get myself checked. If you can come in at that stage, 99% survival. So I don't think you need to worry after that.
Right. Right. So Pratima is also asking, does this affect certain ages, or what is like the youngest anyone can get breast cancer, so that self-examination can begin as early as that?
So the way I describe it is, if anyone has breasts, they can get breast cancer. So it is right from the beginning. However, as every cycle, because it depends upon the onslaught of the hormones on the breast, with every cycle, with every year that passes, your risk of developing breast cancer will increase. So how often, minimum age of starting breast cancer would be when you start being aware that these things, how to examine myself. So I would even suggest getting a self-examination done when you're starting at 18, 16. The minute you start knowing about your breast, get to know your breast right at the beginning. So start self-breast examination as early as possible. There's nothing, you're not exposing yourself to any rays, you're not exposing yourself to any harmful chemicals or dyes or anything else. Just your fingers on your breast. That's just start right at the beginning. That would be what I would say.
Super. This is an interesting one. A question from Ritika. She's asking, are there any alternate medicines for treating breast cancer?
So it's chemotherapy, surgery, radiotherapy. There have been a lot of studies where people have said that they tried alternative methods, older types of treatment strategies, and have benefited from it. And but I feel that these are more anecdotal. So I would not suggest putting a lot of faith in those. If you have come to us like at the last stage, stage 4, nothing else is working, and you want to try something else to see if it would work, then that's fine. But ideally, chemo, surgery, radiotherapy, we have such high success rates that I don't think we should go for all of the other potential alternative drugs or I don't know, acupuncture or
Right.
other types of therapy.
Right. On this, I want to also ask you one more question about prevention of breast cancer. Well, like you said, that there are modifiable factors of diet, lifestyle, exercise. But are there any kind of preventive medications or surgeries that can help avoid breast cancer?
So there is prophylactic mastectomy. That is, before you get cancer, you remove the breast. It has been shown to be effective in 95% of the cases. The reasoning is basically there is no breast, there will be no chance of getting breast cancer. But is it the right approach for every single person to do it? Would be like it is. Breast become a part of it. It's an irreversible surgery. Once you remove the breast, you can reconstruct the tissue, but you can't get the breast back. It won't grow back. So it's an irreversible surgery. So if you're considering doing prophylactic breast cancer, you would breast surgery, you would require a lot of genetic counseling. First of all, finding out if you're really susceptible because of the genetic factors. Then also, it's 1 in 10 breast cancer cases that are inherited. So what about the other 9 cases? So we can't. So my outlook to this would be, do the self breast examination. If you do the self breast examination, you will know right at the start the smallest change. At that point in time, you can take the call on doing something irreversible as surgery. But if you are, say, for example, belonging to the Aster community, or 3 or more family members in your family already have breast cancer, people are getting breast cancer in your family at 45, 35, so you know you're at very high risk. Then talk to your doctor. Get yourself genetically screened. You also have the factors. After all that counseling, then you can take the decision of doing something as irreversible as prophylactic mastectomy. Yeah. Because there is, once you have committed to that and you've done the surgery, there is no turning back.
True. Dr. Raskah, one final question before we close the session, and this is for people who've had a breast cancer issue in the family. Maybe they don't have it, but a family member or a friend. What kind of support should family and friends provide in this scenario?
So first of all, it would be knowing that breast cancer people feel very isolated. Like I know of a couple of people who were affected by breast cancer who then go into a lot of depression and things like that, thinking about, for some reason, I feel women think every disease that happens is because of them. Like they have a lot of guilt associated with it. So just hearing the person who's suffering from the breast cancer, like what do they need? A lot of times, if the lady who has a breast cancer has a daughter, now she'll have the added guilt of thinking she's going to hand over this breast cancer to her daughter. So hearing her out would be one of the best things you can do. Then depending on how close you're to the person, maybe you could do a couple of chores around the house, especially when they're going through chemo, they're feeling very run down, supporting them. Then there are a lot of cancer support groups, making sure that they go to these cancer support groups, because when women come together and discuss their different stories, they kind of help people understand that they are not alone. One of the worst things that cancer does is isolating the person, that they feel completely alone. Nobody else can fight this fight for them. But realizing that it's not just them, like 1 in 8 women is going to have breast cancer. So it's not really a solitary disease. You're not the only person suffering from it. Listening to other people's stories, just hearing them out would be some of the best ways you could support someone you care about.
Absolutely. Well, thank you so much, Dr. Raskah. I think it's been a very, very insightful session. Thank you for answering my questions and those coming in from the audience as well. I think there is one thing. I've spoken to a number of doctors regarding different kinds of cancers, and this one is no different, where you stress upon the fact that there should be self-examination and early detection, because that can literally save lives. So this is Yes, so this is something that we would like to emphasize on in this session as well, so that please keep checking and keep doing a self-examination. We want to raise as much awareness as we can about breast cancer. It is a serious disease, and we really want this session to benefit everyone. You can also check Policybazaar.ae for the different kinds of health coverages they have, and you must take one of those for peace of mind. So please do that. Any final thoughts, Dr. Raskah?
Oh, thank you so much for having me here, and thank you so much for this platform and this live session, because it's helping spread awareness. I feel at the end of the day, if we have saved even one lady's life today, it has made a difference in so many lives. So thank you so much. This is a really good platform. Thank you so much.
Yes. Thank you so much, Dr. Raskah. And once again, thank you to our audience, and thank you for sending in those questions. And remember, no question is a silly question when it comes to breast cancer or any other kind of health condition. So go out there, check, get in touch with your doctors or anybody in your family who's a health expert. Reach out to them and ask as many questions as you may have. Any doubts, have them cleared. And yeah, keep raising awareness. Thank you so much. My name is Priya Jethani, and it's been lovely hosting this insightful session. Thank you, and we'll see you again next time.
Thank you so much.